During intravenous infusion therapy, around 10 million very small particles may enter the patient's bloodstream over a 24-hour period of time. These microparticles are derived from various sources and can lead to increased complication rates and longer hospital stays for patients. This may also result in higher additional costs for the hospital. Pall infusion filters retain these contaminations, providing additional patient safety and ultimately reducing costs. The hydrophilic main membrane of the filter effectively retains particles and microorganisms. Positively charged 0.2 micrometer also retain endotoxins. Air inclusions are eliminated from the infusion fluid by an additional hydrophobic membrane. Filters with a validated service life of 96 hours reduce the cost of infusion therapy, for example, by reducing nursing time. They also minimize the number of infusion set manipulations required. The filter is very simple to use. As soon as the patient arrives in the ICU, a decision is made initially as to which central venous catheter to use. This requires careful allocation of the various drugs that are to be administered to individual catheter lumens or IV lines to avoid possible drug incompatibility reactions. Software tools can be used to help determine, for example, into which line to inject and whether any filter flush steps are additionally required in order to avoid possible drug incompatibility reactions. For example, the result from the drug planning process is a 4-lumen CVC for the infusion of nutrition, sedatives, catecholamine, and a separate lumen for drugs given in conjunction with saline solution and for central venous pressure measurement. Suitable filters have to be selected for each line. For crystalline solutions, for example, the ELD96 with a 0.2 micrometer filter positively charged membrane. For drugs with low flow rates, such as catecholamines or sedatives, the smaller Neo96 filter with a 0.2 micrometer positively charged filter membrane, and for solutions containing fats, the TNA1 with a 1.2 micrometer filter membrane. Filters are placed close to the patient, between the infusion system and the CVC. Priming of the filter is done by first filling a syringe with the required drug or solution, and then connecting an infusion line and the filter. The filter is held upside down and completely filled with the solution from the syringe. During priming, air is expelled from the filter, and it can be connected to the CVC without the risk of air remaining in the system. Alternatively, filters can also be primed with a carrier solution, such as saline. Particles occurring as a result of drug incompatibility reactions can block a filter, which triggers the pump alarm. This alarm function is a significant advantage of infusion filters. With Pall infusion filters, you and your patients will always be on the safe side. Pall Medical, Filtration Separation Solution.